I think the biggest change or the biggest takeaway from the COVID-19 pandemic related to water usage in buildings is the critical need to address building water quality. Building and business closures for weeks or even a handful of days obviously reduces water usage, and this can lead to stagnant water and degraded water quality inside building plumbing. When we talk about degraded water quality, we mean that the residual sort of disinfectants or similar that the utility is using to treat water sort of degrades over time, and that could result in an increase in the growth of opportunistic pathogens. And when we talk about opportunistic pathogens, we really mean things like the Legionella bacterium, disinfectant byproducts, perhaps the increased presence of heavy metals, lead and copper from piping systems, and really there's a risk that stagnant water can, create conditions where water in buildings is unsafe to drink or otherwise use for domestic or commercial purposes. So huge human health implications related to, building water systems, as well as at the utility level, right? So, the utility may also be experiencing declining flows. So it's important that building owners, operators work really closely with their utility and their local public health department to ensure that they're addressing this holistically and effectively. I think this consideration of building water quality is uncharted territory for many building owners. So now, in a way that we haven't in the past or in the recent past, we're really asking building owners to take responsibility for building water quality. Whereas before, at least in North America, I would say we had relied on the utility to ensure that adequate quality of water supply. It's interesting, and I know others are thinking about this question. I was on a webinar a couple weeks ago, and Purdue University, the Purdue University Center for Plumbing Safety, has tracked that there have been something like nearly 50 guidance documents that have been published since March 2020 that are telling building owners what they need to do to prevent and deal with water stagnation situations. So this is a new space, I think, for the much of the buildings industry, at least in North America, and we are seeing industry organizations working together, trying to assemble and disseminate best practices. At USGBC, we're focused keenly on this, of course, as well, especially through the lens of LEED and what requirements can we put in place to give teams a framework to deal with this issue. USGBC recently published a new pilot credit, a safety-first pilot credit, building water system recommissioning. And again, that really tries to help building owners reduce occupant exposure risk to degraded water quality. This credit tries to integrate the various recommendations that we've seen from industry organizations and building water systems experts, including, of course, the EPA, the CDC, and also referenced are some of the great resources that have been put out by the Purdue University Center for Plumbing Safety. The pilot credit requirements are available to take a look at in our pilot credit library, but at a high level, we're asking teams to develop and implement a building water management plan in accordance with the ASHRAE Standard 188. We're asking them to contact, again, their local water authority and government public health authority to understand local requirements and coordinate sort of reopening activities. We want project teams to proactively communicate building water system recommissioning activities and associated risks to occupants, so ensuring everyone is on the same page about water systems testing and potential flushing disinfection activities that are taking place. So the pilot credit sort of lays out steps that teams would take to address water quality, starting with the sort of community supply as well as water quality inside the building, and then specifies flushing and disinfecting the building water systems as needed based on those water quality testing results.